Worse. Plain chest radiograph demonstrates bibasal reticular shadowing with volume loss. HRCT demonstrates bibasal fibrosis and traction bronchiectasis. Incidental note is made of a patulous esophagus. Which of the following is the most likely cause? A. Tuberculosis. B. SLEC, rheumatoid arthritis. D. Wegener's granulomatosis. E. Scleroderma. 2. A 35-year-old woman presents. Module 1. Cardiothoracic and vascular. Answers. 1. E. Scleroderma. Whilst hemoptysis may be a presentation in tuberculosis, and Wegener's and bibasal fibrosis may be seen in all of the above except tuberculosis, where apical fibrosis is the more likely feature, scleroderma is the only condition resulting in a patulous lower esophageal sphincter, esophageal shortening and stricture formation. Ref. Dannert p. 863. presence with chest infection and pyrexia, and the plain film reveals dense lobar consolidation with bulging fissures. The likely microorganism is A. Legionella pneumophila B, Pneumocystis carinii C, Staphylococcus D, Streptococcus E, Klebsiella. 3. A 40-year-old has a routine chest radiograph as a part of pre- 2e. Klebsiella causes a dense pneumonia with bulging of fissures often associated with an empyema. Pneumococcal pneumonitis can also mimic this. Ref. Dannert p. 504. Pre-immigration workup. This demonstrates a mass on the left with loss of the upper left heart border. The descending aorta can, however, be seen despite the mass. Which of the following is the most likely location of the mass? A. Apical-posterior segment B, lingula C, anterior segment of the upper lobe D, posterior basal segment of the lower lobe E, lateral basal segment of the lower 3. B. Lingula. This is an example of the silhouette sign. Sign where an anteriorly located lingular mass results in loss of the upper left heart border, but preservation of the outline of the posterior descending aorta. Ref. Granger and Allison P. 3. Lower lobe. 4. In an investigation for lung malignancy, all of the following may produce a false positive result on a PET-CT except A. Pulmonary hamartoma B, intralobar sequestration C, tuberculosis D, pneumonia E, scarring. (319) 4b. Intralobar sequestration. Active tuberculosis, consolidation, atypical pulmonary hematomas and scars may cause false positive results. Uncomplicated sequestration will not demonstrate FDG uptake. Ref. Park CM ETAL tumors in the tracheobronchial tree, CT, and FDG PET features. Radiographics 2009. 5. A 70-year-old man, previously working in a shipbuilding yard, presents with progressive breathlessness. Chest radiograph demonstrates bilateral calcified pleural plaque disease. 1. With volume loss. Lung function shows a restrictive pattern. HRCT reveals pulmonary fibrosis. The most likely site of these changes would be A. Perihilar B, apical C, peribronchial D, subpleural. E. Fissural. 2009, 29, 5571. 5d. Subpleural pulmonary fibrosis associated with asbestos exposure is seen mainly in a subpleural distribution towards the lung bases. Ref. Dannert P. 4. 464. Six. A 35-year-old man undergoes autologous bone marrow transplantation following successful treatment of lymphoma. 2 weeks later he develops scattered bilateral progressive breathlessness and dry cough. HRCT demonstrates several areas of bilateral ground glass changes with associated reticular changes but no effusions. What is the most likely explanation? A. Angioinvasive aspergillosis. B. Lymphoid interstitial pneumonia. C. CMV pneumonia. D. Drug toxicity. E. Pulmonary edema. 7. A 6. $464. 6D. Drug toxicity post-transplant pulmonary complications may develop in up to 40-60% of patients. In the first 2 weeks or so after transplantation, neutropenia is the underlying cause for most of these. Angioinvasive aspergillosis presents in the first 2 to 3 weeks, usually as multiple ground glass nodules with or without cavitation and peribronchiolar consolidation. Lymphoid interstitial pneumonia, LIP, is a late-phase complication usually seen more than 3 months after transplantation and may be an indication of chronic graft versus host response. CMV pneumonia may manifest at any time in the first 100 days after transplantation. 14. Multiple nodules with associated ground glass changes or consolidation are usually seen, but reticular change is not a feature. Pulmonary edema is also seen in the neutropenic phase in the first 2 to 3 weeks. Whilst ground glass changes and interstitial lines are seen in pulmonary edema, associated pleural effusion is common. Drug toxicity due to a variety of chemotherapeutic agents is seen in the neutropenic phase as a combination of ground glass and reticular changes. A 67-year-old man presents with abdominal discomfort 3 months after endovascular repair of an abdominal aortic aneurysm. The patient undergoes a non-contrast CT followed by an arterial phase study. There is high attenuation on the non-contrast study between the stent and the aortic wall, which enhances further in the arterial phase. The graft itself is intact, as are the attachment sites. Which of the following is the most likely cause for the appearance? A. Type I endoleak. B. Type 2 endoleak. C. Type 3 endoleak. D. Graft infection. E. Dissection 8. A 16-year-old Changes. Ref. Dannert P. 469. 7b. Type 2 endoleak. Type 2 endoleaks are due to retrograde flow from the small branches of the aorta such as the lumbar arteries. A type I endoleak is due to a seal failure at either end. Type 3 is due to a defect in the graft, and type 4 is due to graft porosity. Ref. Dannert P. 6. "16-year-old with headache and hypertension has a chest radiograph which demonstrates plain radiographic signs of coarctation of the aorta. Further investigations reveal anomalous post-coarctation origin of the right subclavian artery. The ribs most likely to demonstrate inferior rib notching would be A. Left 3rd to 9th ribs, B. Bilateral 3rd to 9th ribs, C. C. Right third to ninth. E. Left first and second ribs. 9. A 38-year-old man with progressive dyspnea and chest pain undergoes an echocardiogram which reveals a pedunculated intracardiac mass which is hypointense to myocardium on T1, weighted images, and markedly hyperintense on T2, weighted images. The most likely intracardiac location of the lesion would be A. Right atrium, B. Right ventricle, C. Left atrium, D. (618) 8a. Left third to ninth ribs due to the anomalous origin of the right subclavian artery from the postcoarctation segment. There is no collateral flow to the intercostal arteries on the right. Subsequently, there is no right-sided rib notching. Ref. Dannard P. 630. 9c. Left atrium. The case describes an atriomyxoma, which is more common in the left atrium, 75–80% of cases. These tumors are usually attached to the interatrium septum. Ref. Dannard P. 646. 10. A 56-year-old female is found to have a small, well-defined anterior mediastinal mass on a chest radiograph which demonstrates homogeneous soft tissue density with some peripheral calcification on CT. On MRI it is isointense to skeletal muscle on T1, weighted images, and slightly increased signal on T2, weighted images. It is most likely to be A. Thymic cyst, B. Thymoma, C. 10. B. Thymoma. This case describes the typical features of a thymoma. Thymic hyperplasia and thymic carcinoma are usually ill-defined abnormalities. The signal from the lesion is not typical for a thymic cyst or thymolipoma. Ref. Dannard P. 537. 11e. Pleural effusion. Pleural effusion. Thymolipoma. D. Thymic hyperplasia. E. Thymic carcinoma. 11. A 51-year-old man with long-standing history of an erosive arthropathy of the acromioclavicular joints and bilateral arthropathy in his hands subsequently develops progressive shortness of breath. The most likely abnormality on his chest radiograph would be A. Cavitating nodules, B. Peripheral basal reticulonodular shadowing, C. Cardiomegaly, D. Bronchiectasis, E. Pleural effusion. Effusion is the commonest thoracic manifestation of rheumatoid arthritis, much more common in men. F149:1. It is unilateral in the vast majority of cases. The fluid is an exudate with low sugar content and is often seen in the absence of other pulmonary changes. Ref. Dannert P. 12. A 22-year-old is diagnosed with tuberculosis. Which of the following features will make a diagnosis of primary tuberculosis more likely? A. Mediastinal enlargement. B. Septal thickening. C. Upper zone cavitation. D. Miliary nodules. E. Apical consolidation. P. 528. 12. A. Mediastinal enlargement. Mediastinal lymph node enlargement is a feature of primary TB. The others are seen with reactivation or fibrocavitary TB. Miliary TB can be seen in any phase with hematogenous dissemination, but primary presentation is uncommon. Ref. Danner P. 5. (13) A 26-year-old man suffers a blunt injury to his chest in a road traffic accident. The most common abnormality seen on CT as a result of blunt thoracic injury is A. Pneumothorax. B. Pulmonary laceration. C. Hemothorax. D. Tracheobronchial injuries. E. Pulmonary contusion. (539) 13. E. Pulmonary contusion. Pulmonary contusion is the commonest manifestation of blunt trauma and indicates trauma to alveoli with alveolar hemorrhage without significant alveolar disruption. Whilst 15. Module 1 Cardiothoracic and vascular answers. Plain film changes may not be apparent for up to 6 hours. CT will demonstrate changes almost immediately post-trauma, and signs of resolution can be seen as early as 48 hours. If unresolved, it may progress to ARDS. Ref. Coyole RETAL multidetector CT of blunt thoracic trauma. (14) A 26-year-old undergoes a routine chest radiograph as part of the Australian residency application. The left upper lobe is hyperlucent and hyperexpanded, and a lobular mass is demonstrated adjacent to the left hilum. CT reveals the presence of a dilated bronchus containing a plug of soft tissue. The surrounding lung is emphysema 2. The most likely diagnosis is A. Central carcinoid tumor. B. Bronchogenic cyst. C. Bronchial atresia. D. Cystic adenomatoid malformation. E. Congenital lobar emphysema. Trauma. Radiographics 2008, 28, 1555, 1570. 14. C. Bronchial atresia. The case describes bronchial atresia with mucoid impaction. Bronchial atresia is a congenital abnormality that is usually discovered incidentally. It results in local obliteration of the proximal lumen of a segmental bronchus. The apico-posterior segment of the left upper lobe is most commonly affected. Airways distal to the atretic segment continue to produce mucus, which can lead to mucoid impaction/mucocele. The airways distal to the atretic segment also develop normally and are ventilated by collateral air shift. This results in the affected lobe appearing hyperexpanded, oligamic, and hyperlucent. Congenital lobar emphysema can look similar, however there is usually no mucus plug and patients tend to present early. Ref. Danner P. 471. Emphysema. 15. A 58-year-old man with pancreatic cancer presents with recurrent pulmonary emboli despite adequate anticoagulation. He is shown on this admission to also have a right femoral DVT. He subsequently undergoes an IVC filter placement. Following a flush. 3. Module 1 Cardiothoracic and vascular. Injection in the IVC, injecting contrast at which of the following site is essential prior to stent placement. A. Right hepatic vein. B. Left renal vein. C. Right common iliac vein. D. Right renal vein. E. Left common iliac vein. 16. (471). 15. E. Left common iliac vein. The presence of the renal veins will be demonstrated on the flush IVC injection, and selective injection into the renal veins is not usually necessary. However, it is mandatory to exclude a double IVC. A second IVC originates from the left iliac vein, and can be a cause for failure of the filter despite good positioning. (16) A 40-year-old man presents with worsening breathlessness, fever and chills following a visit to an aviary earlier in the day. HRCT is most likely to demonstrate A. Mid-zone interstitial lines. B. Areas of airspace shadowing. C. Pleural effusions. D. Lymphadenopathy. E. Crazy paving. 17. (16) B. Areas of airspace shadowing. Acute extrinsic allergic alveolitis is predominantly a type 3 hypersensitivity reaction. There is poor correlation between the clinical presentation and the radiological changes. Lymphadenopathy is unusual in the acute phase, but is seen more commonly in recurrent disease. The early changes are mainly in the mid-zones, but the fibrosis that develops in chronic extrinsic allergic alveolitis is mainly in the upper zones. In the acute phase, diffuse airspace shadowing or multiple opacities are seen. Scene. Ref. Dannert P. 494. 17. The staging chest CT of a 40-year-old man with a known primary malignancy demonstrates cavitating pulmonary metastases. The least likely type of primary lesion would be A. Squamous cell carcinoma. B. Malignant melanoma. C. Renal cell cancer. D. Sarcomas. E. Colonic carcinoma. 18. A 25-year-old woman with a long-standing history of non (17) C. Renal cell cancer. Ref. Dannert P. 550. Non-erosive arthritis of the hands, and a malar rash presence with progressive breathlessness and respiratory dysfunction. Blood serology demonstrates anti-DNA antibodies. Which of the following is the most common feature on the chest radiograph? A. Pleural effusion. B. Consolidation. C. Cavitating nodules. D. Pulmonary edema. E. Pulmonary fibrosis. 19. 515. 18. A. Pleural effusion. Whilst all the above are seen in SLE, pleural effusions are the commonest radiographic abnormality. Ref. Granger and Allison pages 365 3. 19. A 40-year-old man with a known malignancy presents with pericardial metastases and pericardial effusion. The metastatic deposits are high signal on T1 weighted imaging. Which is the likely primary diagnosis? A. Lymphoma. B. Lung cancer. C. Melanoma. D. Fibrosarcoma. E. Colorectal cancer. 20. 366. 19. C. Melanoma. Whilst most metastases are low on T1 weighted and high on T2 weighted imaging, metastases from melanoma have a high signal on T1 weighted imaging due to the paramagnetic effects of melanin. 20. The diagnostic role of CT in patients with pulmonary emboli is well established, but a prognostic role is being proposed as well. Which of the following has the most widely accepted prognostic value? A. PA clot burden score. B. Leftward bowing of the interventricular septum. C. Reflux of contrast into the IVC. D. RV/LV diameter ratio. E. PA diameter measurement. D. RV/LV diameter ratio. Ref. Gay BETAL. Can CT pulmonary angiography allow assessment of severity and prognosis in patients presenting with pulmonary embolism? What the radiologist needs to know. 21. A 55-year-old man has a repeat chest radiograph which demonstrates a persistent patch of consolidation for months after a previous radiograph. Bronchial-alveolar carcinoma, BAC, is suspected. Which of the following makes the diagnosis less likely? A. Low attenuation consolidation. B. Negative PET CT. C. Central location. D. Long history of smoking. E. Associated cavitation. Prognosis in patients presenting with pulmonary embolism. What the radiologist needs to know. Radiographics 2006, 26, 2340. 21. C. Central location. BAC can present in a local form as a mass, usually peripheral, subpleural in location, or as diffuse persistent/progressive consolidation in patients with a history of smoking. The area of consolidation is often of low attenuation on CT due to copious mucin production. It is the second most common type of malignancy associated with cavitation. Ref. Dannert P. 4. 473. 22. A 62-year-old man presents with right shoulder pain, which radiates down his arm. A plain radiograph confirms the presence of a right apical mass with destruction of the surrounding ribs. CT-guided biopsy is performed and is likely to reveal A. Large cell lung cancer, B. Squamous cell cancer, C. Small cell lung cancer, D. Adenocarcinoma, E. Carcinoid. 473. 22. B. Squamous cell cancer. The case describes a Pancoast tumor for which squamous is the most common cell type. Ref. Dannert P. 400. Carcinoid. 23. A 25-year-old man has a routine chest radiograph prior to a work permit application. It demonstrates a well-defined, rounded mediastinal mass. Which of the following features on CT would make a diagnosis of bronchogenic cyst less likely? A. Soft tissue density. B. Thick wall. C. Precarinal location. D. Communication with tracheal lumen. E. Unilocularity. 476. 23. B. Thick wall bronchogenic cyst is the most common intrathoracic foregut duplication cyst. It could have all the above features, but in a mediastinal location, the cyst walls are usually thin. Thick-walled cysts are more likely to be esophageal. Ref. Granger and Unilocularity. 24. A 45-year-old man presents with a history of cough and occasional hemoptysis. Plain chest radiograph demonstrates a right paracardiac shadow with loss of the right heart border. Bronchoscopy demonstrates an endoluminal obstructive mass. The most likely site of the lesion would be A. Right upper lobe anterior segmental bronchus. B. Right lower lobe lateral basal segmental bronchus. C. Bronchus intermedius. D. Right upper lobe posterior segmental bronchus. E. Right middle lobe bronchus. And Allison P. 252. 24. E. Right middle lobe bronchus. The features described are of an endoluminal lesion causing right middle lobe collapse. A lesion in the bronchus intermedius is likely to cause both middle and lower lobe collapse. Ref. Granger and Allison pages 3. 25. A 54-year-old man presents with breathlessness and palpitations. Clinical examination reveals a mid-diastolic murmur with presystolic accentuation. Echocardiography confirms the presence of a mobile intracardiac mass in the left atrium attached to the septum by means of a stalk. Which of the following is the most likely feature of the lesion on MRI? A. Hypointense relative to myocardium on T1, weighted images. B. Uniform hyperintense to myocardium on T2, weighted images. C. Uniform enhancement following gadolinium. D. Hyperintense to blood pool and hypointense to myocardium on steady-state free precession, SSFP, images. E. Prolapse of the mass through the mitral valve, best demonstrated on the short axis views. Three 324. 25. A. Hypointense relative to myocardium on T1, weighted images. The lesion described is a left atrial myxoma, which has a heterogeneous appearance on most MRI sequences and usually demonstrates varying enhancement following gadolinium injection. This is due to varying amounts of myxoma 2 tissue, fibrous tissue, blood products, and tumor necrosis. The majority of the lesion will be hypointense to myocardium on T1 weighted images. On SSFP images, it is hypointense to blood pool and hyperintense to myocardium. The tumor prolapses through the mitral valve and is best seen on cinegradient echo imaging with a 4-chambered long axis view. Ref. Sparrow PJ ETAL MR imaging of cardiac tumors. Radiographics 2005, 25, 1255, 1276. 5. Module 1 Cardiothoracic and Vascular. 26. A 34-year-old for drug abuser presents with fever, rigors, and back pain. Blood cultures reveal staphylococcal septicemia. CT demonstrates a mycotic aneurysm. Which of the following is the most likely CT feature? A. Fusiform shape. B. Perianeurysmal soft tissue mass. C. Pseudoaneurysm. D. Periaortic gas collection. E. Neural thrombus. One 1276. 26. B. Perianeurysmal soft tissue mass. Mycotic aneurysms are usually saccular true aneurysms. Periaortic soft tissue mass is a common feature seen in up to 48% of cases. Periaortic gas is an uncommon feature. Mural thrombus and calcification are rare features. Ref. Lee WK ETAL infected, mycotic, aneurysms, spectrum of imaging. Thrombus. 27. An area of abnormality is noted within the juxtahepatic IVC of a patient with cirrhosis undergoing an Mr. scan. The area is hyperintense on T1, weighted imaging, and appears as a filling defect on three-dimensional fat-suppressed volume interpolated breath hold sequence. Appearances vary in shape and location on different images. The abnormality is likely to represent A. Flowing blood, B. Thrombus, C. Tumor thrombus, D. Artifact due to aortic pulsation, E. Pseudolipoma. Imaging appearances and management. Radiographics 2008, 28, 1853, 1868. 27. E. Pseudolipoma. The described feature is a partial volume artifact called pseudolipoma caused by juxtacaval fat above the caudate lobe. It has an association with cirrhosis of liver. Pseudolipoma. 28. A 60-year-old female underwent a right pneumonectomy for bronchogenic carcinoma. Which feature on plain chest radiograph would be a cause of worry 7 days after surgery? A. A sequential increase in the fluid level, B. Shift of the previously central trachea to the right, C. Shift of the previously central trachea to the left, D. Elevation of the right hemidiaphragm, E. Shift of the cardiac silhouette to the right. 29. A 22. 22-year-old asthmatic. 2008, 28, 669, 689. 28. C. Shift of the previously central trachea to the left. All the other changes are expected changes at this stage following a pneumonectomy. However, contralateral shift of the trachea may be indicative of a post-surgical bronchopleural fistula. Presence with recurrent wheeze and productive cough with expectoration of brown sputum. Plain chest radiograph demonstrates multiple pulmonary infiltrates. Which of the following appearances on HRCT would be the most appropriate for acute allergic bronchopulmonary aspergillosis? A. Fingering glove opacity. B. Thick-walled cavity. C. Pleural with or without an effusion. D. Endobronchial mass with distal atelectasis. E. Tree and bud appearance. Monectomy. Radiographics 2006, 26, 1449, 1467. 29. A. Fingering glove opacity. Acute allergic bronchopulmonary aspergillosis is seen as homogeneous, tubular, fingering glove areas of increased opacity in a bronchial distribution, usually involving the upper lobes. These shadows are related to plugging of airways by hyphal masses with distal mucoid impaction and can migrate from one region to another on HRCT. Thick-walled cavities and pleural thickening are features of saprophytic aspergillosis. Endobronchial lesion with distal atelectasis is seen mainly in chronic necrotizing aspergillosis, whilst tree and bud appearance is seen with bronchiolitis in airway invasive aspergillosis. Ref. Frankwit TETAL spectrum of pulmonary aspergillosis, histologic, clinical, and radiologic findings. Radiographics 2001, 21, 825, 830. Appearance. 30. A 36-year-old female with history of pelvic Pelvic pain and severe dysmenorrhea undergoes a pelvic ultrasound examination which reveals uterine fibroid disease. Which of the following imaging features would be associated with the best outcome following uterine artery embolization? A. Submucosal location. B. Subserosal location. C. Associated adenomyosis. D. Calcification. E. Multiple fibroids. 837. 30. A. Submucosal location. Subserosal fibroids, especially pedunculated ones, may often draw their blood supply from adjacent viscera, which may be a cause of failure of the procedure. They are also associated with a higher incidence of complications. Calcific fibroids are less vascular and may not respond well to embolization. Bulky and multiple fibroids may need multiple interventions or surgery. Adenomyosis is a known cause for failure of the procedure. Refs, Kessel and Robertson CH15, Guy SETAL uterine artery embolization for leiomyomas, pre- and post. 31. A young man presents with progressive productive cough and halitosis. He had severe pneumonia as a child. Plain chest radiograph demonstrates bronchial dilatation and 6. Module 1 cardiothoracic and vascular. Bronchial wall thickening with some volume loss. Which of the following HRCT findings is the most sensitive finding for bronchiectasis? A. Air trapping. B. Mucus-filled dilated bronchi. C. Bronchial wall thickening. D. Bronchi seen in the subpleural region. E. Lack of bronchial tapering. 30. Post-procedural evaluation with U.S. Radiographics 2005, 25, 1159, 1172. 31. E. Lack of bronchial tapering. Whilst all the above can be seen in patients with bronchiectasis, a lack of progressive tapering of the bronchi is the most sensitive, 80%. Ref. Dannert P. 407. 32. A 35-year-old female presents with generalized malaise and cough. Cough, occasionally bringing up break skin-like material. Blood screen reveals eosinophilia. The patient has a history of travel to several countries worldwide. Which of the following plain film features is unlikely? A. Homogeneous ovoid opacity. B. Cyst with a fluid level. C. Bilateral opacities. D. Calcification. E. Lower zone location. Location. (471). 32. D. Calcification. The case describes hydatid disease. Hydatid cyst of the lungs can present as solid ovoid solitary or occasionally multiple lesions on plain films. When the cyst communicates with a bronchial tree, an air fluid level is demonstrated. Several other signs are described. Whilst bilaterality is less likely, up to 20%, calcification is extremely rare, 0.7%. Location. 33. A 33-year-old male patient suffering from AIDS presents with constitutional symptoms and dry cough. His CD4 count is 150. HRCT is least likely to show A. Pleural effusion B. Ground glass changes C. Bilateral interstitial infiltrates D. Diffuse alveolar infiltrates E. Pneumatocells. 0.7%. Ref. Dannard P. 500. 500. 33. A. Pleural effusion pneumocystis carinii is the most common cause of pneumonia at this stage of the disease. Pleural effusions and lymphadenopathy are not features of PCP. Ref. Dannard P. 519. 18. Pneumatocells. 34. A 26-year-old female patient with an optic nerve tumor and café au lait spots presence with exertional breathlessness. Imaging of the chest is most likely to reveal which of the following. A. Multiple small lower lobe cysts B. Emphysema C. Lower zone fibrosis D. Thick wall cavities in the upper zone E. Asymmetrical upper zone fibrosis. Module 1 Cardiothoracic and vascular answers. 34. C. Lower zone fibrosis. The case describes neurofibromatosis I, which is associated with lower zone fibrosis and thin-walled bully, mainly in the upper zones. Apart from the pulmonary changes, skeletal abnormalities involving the ribs and spine and mediastinal masses may also be seen. Ref. Dannard P. 315. 35. 35, C. 35. A 52-year-old with cardiomyopathy is referred for delayed contrast-enhanced cardiovascular MR to CMR. The following are all false except A. An inversion recovery pulse of an appropriate TI is applied to nullify the signal from the ischemic myocardium. B. A long TI would nullify the signal from both the normal and diseased tissue. C. A TI of 200 milliseconds would nullify the signal intensity from the normal myocardium. D. Imaging should be commenced immediately. C. A TI of 200 milliseconds would nullify the signal intensity from the normal myocardium. After an initial LV function study, gadolinium is administered and imaging is commenced 100 minutes later in the inversion recovery pulse is used to nullify the signal from the normal myocardium. With a TI of approximately 200 milliseconds, the healthy myocardium appears dark, whilst the ischemic myocardium appears bright. Too short a TI results in loss of signal from both abnormal and normal myocardium, whilst too long a TI would result in loss of contrast. The images are T1, weighted ECG-gated fast gradient echo images. Ref. Jackson EETAL ischemic and non-ischemic cardiomyopathies cardiac MRI appearances with delayed enhancement. Clin Radial 2007, 62, 395 403. Inversion recovery sequence. 36. In the same patient, with cardiomyopathy, which underlying cause and corresponding enhancement pattern are inappropriate. A. Ischemic cardiomyopathy subendocardial pattern in a coronary artery territory. B. Early myocarditis patchy, focal subendocardial pattern. 7. Module 1 cardiothoracic and vascular. C. Hypertrophic cardiomyopathy patchy multifocal changes, commonly the right ventricular free wall, and its junction with the interventricular septum. D. Amyloidosis global and diffuse, commonly subendocardial. E. Dilated cardiomyopathy midwall myocardial enhancement. "37. A 30-year-old man has a routine chest radiograph which reveals a small soft tissue shadow resulting in loss of part of the mid-descending aortic outline. Which of the following is the most likely cause? A. Thymoma in the left lobe. Lobe of thymus. B. Hilar lymphadenopathy. C. Lingular collapse. D. Intercostal schwannoma. E. Teratoma. "36. B. Early myocarditis patchy, focal subendocardial pattern in early myocarditis. The enhancement pattern is typically epicardial. Ref. Jackson EETAL ischemic and non-ischemic cardiomyopathies cardiac MRI appearances with delayed enhancement. Clin Radial 2007, 62, 395 403. 37. D. Intercostal schwannoma. The description is of a posterior mediastinal lesion obscuring part of the descending thoracic aorta. The other lesions are anterior mediastinal apart from hilar lymphadenopathy, which is hilar/middle mediastinal. Ref. Granger and Allison P. 254. 38. D. High signal on T2, weighted images. PMF has a peripheral D. Intercostal schwannoma. E. Teratoma. 38. A 68-year-old minor develops an irregular opacity in the upper zone on plain chest radiograph. Which imaging feature would be more in favor of malignancy than progressive massive fibrosis? PMF. A. Peripheral enhancement on contrast enhanced Mr. B. Peripheral location on axial images. C. Presence of calcification. D. High signal on T2, weighted images. E. Avid lesion on PET CT. 39. A 36-year-old asthmatic attends an outpatient Location which moves towards the hilum on follow-up imaging. Calcification and cavitation may also be seen. PMF lesions can be FDG avid on PET CT. However, high signal in a mass on T2 weighted images is strongly suspicious for malignancy. Ref. Chong SETAL pneumoconiosis. Comparison of imaging and pathologic findings. Radiographics 2006. Outpatient respiratory clinic complaining of recent increasing dyspnea. Two 2006, 26, 5977. Dyspnea. Blood show an elevated white cell count and eosinophilia. Chest radiograph reveals multiple areas of ill-defined peripherally based consolidation. Subsequent chest radiographs over the coming week show the consolidation to resolve in places but commence in other previously unaffected areas. The most likely cause is A. Alveolar sarcoidosis, B. Bronchoalveolar carcinoma, C. Acute eosinophilic pneumonia, D. Chronic eosinophilic pneumonia, E. Loeffler syndrome. 77. 77. 39. Loeffler syndrome. This is described as simple eosinophilic pneumonia, but is of unknown etiology. Pathologically, there is interstitial and alveolar edema. Patients are usually asthmatic/atopic but have mild or no symptoms. Classical chest radiograph appearance is of fleeting infiltrates with transient and shifting peripheral consolidation. Ref. Dannert p. 506. 40. Syndrome. 40. The plain chest radiograph of a 52-year-old male presenting with cough and hemoptysis reveals a veil-like opacity over the left upper zone. CT reveals an endobronchial lesion in the left upper lobe bronchus causing lobar collapse. Bronchoscopic biopsy is least likely to reveal A. Squamous cell carcinoma, B. Carcinoid, C. Lymphoma, D. Metastatic renal cell cancer, E. Bronchiloalveolar carcinoma. E. Bronchiloalveolar carcinoma BAC usually presents as a peripheral, subpleural mass or persistent patch of consolidation. All the others can present as endobronchial lesions. Ref. Dannert p. 473. 19. Module 1 Cardiothoracic. A 60-year-old man who recently suffered a hemorrhagic stroke develops pulmonary emboli. He is referred for an IVC filter insertion, and angiography is performed prior to this. The usual reasons for doing so would be all of the following except A. To identify the renal veins, B. To identify the hepatic veins. 8. Module 1 Cardiothoracic and vascular. C. To size the IVC, D. To rule out the presence of a left IVC, E. To evaluate for the presence of an IVC thrombus. B. To identify the hepatic veins do not need to be identified routinely prior to filter insertion. Most filters are deployed in an infrarenal position, unless there is IVC thrombus which would preclude this, in which case the filter is positioned in the suprarenal position. A left iliac injection is performed to rule out a left IVC, which could be a cause of filter failure. Ref. Kessel and Robertson ch. 16. D. To rule out the presence of a left IVCE. To evaluate for the presence of an IVC thrombus. 42. A 22-year-old female patient with a known phacomatosis presents with anemia and hypertension. CT angiogram reveals evidence of active bleeding in some of the multiple areas of low attenuation, approximately 20, seen scattered throughout both her kidneys. Which of the following features may be seen on chest CT? A. Multiple pulmonary AVMs. B. Multiple bilateral small cysts. C. Mediastinal mass. D. Thin-walled upper zone bully. E. Cardiac rhabdomyomas. Performed to rule out a left IVC, which could be a cause of filter failure. Ref. Kessel and Robertson CH16. 42. B. Multiple bilateral small cyst phacomatosis are a group of neurocutaneous syndromes, several of which have other multisystem abnormalities, including introthoracic findings. These include neurofibromatosis IN2, Sturge-Weber syndrome, von Hippel-Lindau syndrome, Osler-Rondeau-Weber syndrome, and tuberous sclerosis. The above features describe multiple renal angiomyolipomas, which are a feature of tuberous sclerosis. These patients may demonstrate multiple thin-walled cysts with lower zone fibrosis, form Frust of Lamb. Ref. Dannert P. Rhabdomyomas. 43. A 33-year-old female patient presents with a long-standing history of fever, dry cough, and weight loss. The chest radiograph reveals mediastinal lymphadenopathy. Blood investigations reveal hypercalcemia and elevated angiotensin-converting enzyme, ACE. Which of the following appearances of lymphadenopathy on CT would be the least likely feature in favor of the clinical diagnosis? A. Bilateral hilar lymphadenopathy. B. Eggshell calcification. C. Predominant involvement of the right paratracheal lymph nodes. D. Lymphadenopathy without any parenchymal involvement. E. Posterior mediastinal lymph nodes. P. 331. 43. E. Posterior mediastinal lymph nodes. All the above are features of mediastinal lymphadenopathy in sarcoidosis. Whilst sarcoidosis can involve different mediastinal and hilar groups, posterior mediastinal lymphadenopathy is a feature of NHL. Ref. Ref. Dannert P. 500. Nodes. 44. The HRCT of a 35-year-old patient with shortness of breath and reticulonodular disease pattern on plain chest radiograph reveals cavitating nodules with interstitial septal thickening. Which of the following diagnoses is the least likely? A. Lymphangioliomyomatosis. B. Langerhans cell histiocytosis. C. Wegener's granulomatosis. D. Sarcoidosis. E. Rheumatoid lung. (529). 44. A. Lymphangioliomyomatosis. LAM. The cysts in LAM are thin-walled air-containing cysts, rather than cavitation in nodules. Refs. Dannert P. 508. Grant LAETAL cysts, cavities. Lung. 45. 8 days after lung transplantation for alpha-1 antitrypsin deficiency, a 45-year-old man develops pyrexia, breathlessness, and desaturation. HRCT reveals perihilar heterogeneous opacities and ground glass changes with new pleural effusion and septal thickening. Which of the following is the most likely cause? A. Reperfusion edema. B. Acute rejection. C. Anastomotic dehiscence. D. Post-transplantation PCP infection. E. Hyperacute rejection. Disorders, differential diagnosis and findings on thin section CT, Clin Radiol 2009, 64, 439 for 48. 45. B. Acute rejection, hyperacute rejection presence within hours of the transplantation. Reperfusion edema usually presents within 24 hours of the transplantation, peaking by about day 4. Post-transplant infections can be broadly divided into those occurring within the first month, gram-negative bacteria, fungi, candida, aspergillosis, and those occurring after the first month, CMV, PCP. Anastomotic dehiscence is usually an early feature, but the presentation and features are not those described. Ref. (46) A 45-year-old female patient with history of rheumatic fever, as a child presents with progressive shortness of breath and paroxysmal nocturnal dyspnea. Clinical examination reveals a pansystolic murmur associated with a mid-diastolic murmur with presystolic accentuation best heard over the cardiac apex. Clinical examination end. 9. Module 1 Cardiothoracic and vascular. Plain film do not reveal evidence of heart failure, but several features of left atrial enlargement are noted. Which of the following is not one of those? A. Double atrial shadow on the right. B. Straightening of the right heart border. C. Elevation of the left main bronchus. D. Splaying of the carina. E. Displacement of the descending aorta to the left. Ref. Dannert P. 506. 46. B. Straightening of the right heart border. Left atrial enlargement results in straightening of the left heart border as a result of enlargement of the left atrial appendage. This is especially a feature of rheumatic mitral valve disease. Ref. Granger and Allison pages for 71 for 72. 47. C. Left. 47. A 70-year-old man undergoes surgery for AAA. 2 weeks following surgery, he is readmitted to the A&E department with abdominal pain and fever. Palpation of the abdomen suggests a pulsatile mass. A CT angiogram is performed, which does not demonstrate contrast extravasation. Which of the features on CT angiogram would be most worrisome? A. Presence of a pseudoaneurysm. B. Periaortic soft tissue. C. Thickening of a fluid-filled third part of the duodenum. D. Some ectopic gas in the vicinity. E. Loss of fat plane between the grafted aorta and the adjacent duodenum. 48. C. Thickening of a fluid-filled third part of the duodenum 2 weeks post-procedure. All the other features, including the presence of ectopic gas, may be postoperative. However, presence of a thickened fluid-filled bowel loop would be extremely worrying for an aortoenteric fistula. Presence of ectopic gas beyond 4 weeks is much more likely to be abnormal. 20. .48. A 7-year-old boy .20. Boy with no known medical history presents with hypertension and postprandial abdominal pain. CT reveals an abnormality in the abdominal vasculature. Subsequent angiogram demonstrates occlusion of the celiac axis and superior mesenteric artery and tapering of the mid-aorta. Delayed imaging shows vessel reconstitution through collaterals. The most likely diagnosis is A. Takayasu arteritis, B. Meteoritic syndrome, C. Neurofibromatosis, D. Marfan syndrome, E. Syphilitic aortitis. Module 1 Cardiothoracic and Vascular Answers. Ref. VUQD ETAL aortoenteric fistulas, CT features and potential mimics. Radiographics 2009, 29, 197-209. 48. B. Meteoritic syndrome. Meteoritic syndrome is a rare vascular abnormality which manifests as narrowing of the abdominal aorta and its branches, including renal arteries, hence hypertension. Its cause is unknown, but it is non-inflammatory and non-atheromatous. Patients typically present after the age of 5 years. Diagnosis is made with angiography which reveals smooth, segmental stenoses. Takayasu arteritis, Ta, and neurofibromatosis, NF, are amongst the differentials. The latter can have mid-abdominal aortic stenosis. However, Ta usually affects older patients, 12-66 years, and affects females to a much greater degree am, F141:8. Patients with NF and Marfan's would usually have prior medical history. Syphilitic aortitis is rare and typically affects older patients, 40-65-year-olds. Refs, Dannert P. 655, Pope TL. Ant Minis Atlas and Imaging-Specific Diagnosis. Edition 2. Philadelphia, Pa, Lippincott Williams and Wilkins, 2004. A patient with a known collagen vascular disease has pulmonary fibrosis. Fibrosis. HRCT reveals bilateral lower lobe bronchiectasis. Which collagen vascular disease is most likely? A. Sjogren's syndrome, B. Progressive systemic sclerosis, C. SLED, rheumatoid arthritis, E. Dermatomyositis. 49. A. Sjogren's syndrome. Whilst pulmonary fibrosis is a feature of all the above conditions, bronchiectasis is most likely seen in Sjogren's syndrome. Ref. Dannert P. Dermatomyositis. 50. A 30-year-old female patient. P. 398. Patient with a history of recurrent lower respiratory tract infections as a child presents with cough and dyspnea. Chest radiograph demonstrates a smaller hyperlucent left lung. Which of the following features is unlikely to be seen on HRCT? A. Air trapping. B. Small left hemithorax. C. Diminished size of pulmonary vessels. D. Bronchiectasis. E. Left hilar enlargement. (398) 50. E. Left hilar enlargement. The case describes Swyer-James syndrome, McLeod syndrome. This is a post-infectious constrictive bronchiolitis which causes a small, hyperlucent lung with bronchiectasis and air trapping and expiration. The number and size of pulmonary vessels are also diminished, resulting in a small ipsilateral hilum. Enlargement. 51. A 60-year-old man presents with a 6-month history of shortness of breath, wheeze and a recent episode of hemoptysis. Plain chest radiograph reveals partial right middle end. 10. Module 1 cardiothoracic and vascular. Lower lobe collapse. This is further confirmed on CT, which also suggests an endobronchial lesion in the bronchus intermedius. It is FDG avid on PET CT scan. Bronchoscopy reveals a smooth submucosal lesion. The histopathology of the lesion is most likely to be A. Mucoepidermoid carcinoma. B. Typical carcinoid. C. Renal cell carcinoma metastasis. D. Adenoid cystic carcinoma. E. Squamous cell papilloma. Hilum. Ref. Danner P. 533. 51. D. Adenoid cystic carcinoma. Adenoid cystic carcinoma is the second most common malignancy of the central airways after squamous cell cancer and often presents as an endoluminal mass with an intact mucosa. Mucoepidermoid carcinoma is rare. Benign tumors are mostly of mesenchymal origin and are rare. Carcinoids in these locations are usually of the typical type. Ref. Park CM ETAL tumors in the tracheobronchial tree, CT, and FDG PET features. Radiographics 2009, 29, 50. Papilloma. 52. A 36-year-old female awaiting liver transplantation undergoes routine preoperative planning ultrasound examination of the abdomen. Whilst the rest of the abdomen is normal, a 4 cm splenic artery aneurysm is seen, which is subsequently confirmed on CT. Which of the following would be the preferred course of action? A. Follow-up ultrasound scan in a year's time. B. Referral to the surgeons for a splenectomy. C. Thrombin injection of the aneurysm. D. Endoscopic ligation of the aneurysm. E. Coil embolization of the aneurysm. (5571) 52. E. Coil embolization of the aneurysm. This patient was discovered to have an incidental asymptomatic aneurysm. Prophylactic embolization is generally offered to 3 groups of patients. 1. Those who have aneurysms greater than 2.5 centimeters in size. 2. Those with portal hypertension. 3. Those awaiting liver transplantation. Percutaneous splenic artery aneurysm embolization using coils is the preferred treatment. Thrombin injection is usually preferred in cases where embolization has failed. Aneurysms with wider necks often need additional measures such as a detachable balloon. 21. Module 1 cardiothoracic and vascular answers. Answers. Ref. Madoff DC ETAL splenic arterial interventions, anatomy, indications, technical considerations, and potential complications. Radiographics 2005, 25, S191 S211. 53. C. Aneurysm. 53. A 59-year-old male presents with left shoulder pain and tingling in his fingers. Plain chest radiograph reveals the presence of a left apical mass with some rib destruction. CT confirms the presence of a superior sulcus tumor at the left apex with no evidence of nodal or distant metastasis. The patient is referred for a MR scan to assess resectability. Which of the following is appropriate? A. Coronal T1. Weighted images are best to identify involvement of the brachial plexus. B. T2. Weighted images are vital to assess resectability and should be performed first. C. Axial images are best to assess spinal canal and foraminal involvement. D. Use of intravenous contrast is necessary to identify the subclavian vessels in their relation to the brachial plexus and the tumor. E. Imaging is usually performed using a Using a body coil. 54. A 60-year-old hypertensive man presents with sudden onset severe interscapular pain. CT reveals a high attenuation crescent in the wall of the proximal ascending aorta with inward displacement of part of the calcific wall, which extends just up to the brachiocephalic artery. Post-contrast scan does not demonstrate leak of contrast into the crescentic area or mediastinum. The patient is hemodynamically stable. The next appropriate course of action is A. Urgent cardiothoracic referral. B. Contact the interventional radiologist for consideration of endovascular stenting. C. Follow-up scan after 24 hours. D. Medical treatment aimed at controlling blood pressure. E. Emergency cardiac MRI. C. Axial images are best to assess spinal canal and form. C. Follow-up scan after 24 hours. D. Medical treatment aimed at controlling blood pressure. E. Emergency cardiac MRI. 55. A 30-year-old female with uncontrolled hypertension undergoes a Mr. angiogram of the renal arteries. This reveals bilateral renal artery abnormalities. The most likely abnormality is A. Bilateral osteostenosis. B. Bilateral long segment stenosis. 11. Module 1 Cardiothoracic and vascular. C. 55. E. Multiple stenoses of the mid-portion of the renal arteries in a female patient of this age. Fibromuscular dysplasia is the most likely abnormality. Fibromuscular dysplasia involves the mid and distal portions of the renal artery as well as the intrarenal branches, with multiple stenoses and aneurysms revealing a string of beads appearance. The ostia and the proximal portion are much less commonly involved. It responds very well to angioplasty, unlike osteoatherosclerotic disease, which often needs stenting. Typically, it is the medial layer that is affected, although all layers. E. Multiple stenoses of the mid-portion of the renal arteries. 56. A 45-year-old woman with severe portal hypertension and variceal bleeding is referred for a transjugular intrahepatic portosystemic shunt. Tips. Procedure following the failure of endoscopic procedures in controlling the bleeding. Which of the following is the most appropriate regarding tips? A. The middle hepatic vein is the preferred route of access to the portal vein. B. The right portal vein is usually posterior to the right hepatic vein. C. Flow of contrast towards the porta hepatis usually indicates puncture of the biliary tree. D. The gradient across the shunt should be less than 20 mmHg. 56. C. Flow of contrast towards the porta hepatis usually indicates puncture of the biliary tree. Usually the right hepatic vein, RHV, is the preferred route of access to the right portal vein, which lies anterior to the RHV. Flow of contrast towards the porta, and especially if it remains there, usually indicates biliary puncture. Puncture of portal vein and hepatic artery usually result in contrast flowing to the periphery. The shunt gradient should be less than 12 mm of mercury. Stenoses usually tend to occur in the hepatic vein, or the shunt itself. Ref. Kessel and Robertson, ch. 16. 3D. The gradient across the shunt should be less than 20 mmHg. Stenosis tends to occur in the portal vein. 57. Following a deceleration injury in a road traffic accident, a young man presents to the A&E department with shock, chest wall contusion, and severe chest pain. An aortic injury is suspected. Which of the following is least likely? A. A normal chest radiograph has high negative predictive value. B. Aortic injury is the usual cause of mediastinal hematoma. C. The aorta just beyond the left subclavian artery is the most common site of injury. D. 57. B. Aortic injury is the usual cause of mediastinal hematoma. A normal chest radiograph has a very high negative predictive value, 95-98%, and the absence of a mediastinal hematoma on a non-contrast CT also effectively rules out. 22. Module 1 Cardiothoracic and vascular answers. The presence of aortic injury. The source of the mediastinal hematoma is usually the azygos, hemiazygos, internal mammary, and intercostal vessels. Aortic injury is usually circumferential, 85%. Ref. Dannert P. 659. 58. A 45-year-old man with a known atrial septal defect, ASD, presents with breathlessness and mild cyanosis. Clinical examination reveals a loud second heart sound and a prominent parasternal heave, but no signs of heart failure. Echocardiogram demonstrates a shunt reversal. Which of the following is not a usual feature on the imaging? A. Paucity of peripheral pulmonary vasculature. B. Enlarged central pause. C. Right ventricular hypertrophy. D. Dilated pulmonary veins. E. Linear calcification of the main pulmonary arteries. 58. D. Dilated pulmonary veins. This patient has developed Eisenmenger syndrome with reversal of his long-standing left to right shunt across the ASD. All of the features listed except dilated pulmonary veins are generally present. Ref. Dannert P. 635. E. Linear calcification of the main pulmonary arteries. 59. 59. A 60-year-old man presents with progressive breathlessness. The plain chest radiograph reveals reticular shadowing in the right lower zone, but is otherwise unremarkable. HRCT demonstrates the presence of beaded thickening of the interlobular septae forming a polygonal reticular network in the right lower lobe with central dots within. There is also a small pleural effusion. Which of the following is the most likely cause? A. Sarcoidosis. B. Bronchogenic carcinoma. C. Heart failure. D. Extrinsic allergic alveolitis. E. Fibrosing alveolitis. Ref. Dannert P. 635. 59. B. Bronchogenic carcinoma. The changes described indicate lymphangitis carcinomatoses. While similar appearances are seen in sarcoidosis, the changes are usually in the upper lobe and pleural effusion is rare. In heart failure, the interlobar septal thickening is usually smooth and usually bilateral. In EAA, pleural effusion is rare and changes are more bronchocentric and bilateral. The polygonal structure is usually distorted in both EAA and cryptogenic fibrosis, where the changes are again subpleural. Ref. Dannert P. 509. 60. C. Field in Alveolitis. 60. A 32-year-old patient with congenital heart disease is referred for a cardiac MR examination. Regarding cardiac MR imaging, which of the following applies? 12. Module 1 Cardiothoracic and vascular. A. Dark rim artifacts are typically seen on the epicardial aspect on perfusion imaging. B. Radiofrequency artifacts are typically sporadic and transient, affecting few images in a series. C. Field inhomogeneity artifacts are more common on a 3T scanner than a 1.5T scanner. D. Of the two Cine MR imaging techniques, at the same bandwidth, image acquisition is quicker with an SSFP sequence than spoiled GRE imaging. E. Perspective gating is preferred for assessing diastolic. Inhomogeneity artifacts are more common on a 3T scanner than a 1.5T scanner. Dark rim artifacts are typically seen on the endocardial aspect on cardiac MR imaging. Spike artifacts are typically sporadic and transient, whilst RF artifacts usually involve all images of the series. At the same bandwidth, image acquisition is quicker with spoiled GRE acquisition. However, often, a lower bandwidth has to be used to improve the signal-to-noise ratio of these sequences, and so SSFP imaging may be quicker. In perspective gating, to compensate for physiologic variations in heart rate, the acquisition window is usually 10-20% shorter than the average R interval, missing out on the end diastole, and hence it is not very useful for assessing diastolic dysfunction. Ref. Seremi FETAL optimizing cardiac